Nationwide, WIC works with over 6 million infants and children every single month. But local WIC staff will tell you that their work is focused on just one child, the one in front of them at that very moment. When that child is in a WIC clinic, he or she gets staff's full attention, not just for nutritional needs, but for his or her overall healthy development. After all, safeguarding the health of young children is WIC's mission. That's why WIC has teamed up with the University of Missouri to design a simple, free program that helps with monitoring developmental milestones, a critical aspect of children's health. Developmental milestones are a way of assessing how a child plays, learns, speaks, acts, and moves for his or her age. Using materials developed by experts at the Centers for Disease Control and Prevention, the WIC Developmental Milestones Program was co-designed by WIC staff for WIC staff. This ensures a program that is focused on children, meaningful to families, and easy for staff.
As a result, the program fits seamlessly into WIC. It can be linked to nutrition education, referrals, and participant-centered goals when appropriate. The Developmental Milestones Program gives WIC staff a reliable, professional tool to use with parents to monitor their children's development. And it does this in a positive, supportive way that engages parents and encourages them to take an active role in their children's developmental journey.
Now the Developmental Milestones Program has been implemented and refined by 8 local WIC agencies and is ready for broad adoption. The program is in alignment with WIC objectives and practices. It's highly rated by WIC staff for ease and effectiveness. It's proven effective with getting children the services they need, and there is no cost to local agencies. It's important to note that the developmental milestones checklists are not screening tools, nor are they indicators of developmental delay or disability. Rather, this program is designed to monitor children's development and to help staff decide when to refer to the child's doctor for developmental screening.
Well, I think the WIC program and the Developmental Milestone Program are perfect partners because, the main focus for the WIC program is for healthy children. To give children a healthy start in life. So we see them multiple times, and I think our WIC staff develop a very trusting relationship with the client because they do come in and see us so often, and they're used to talking to our staff about the health of their children.
Here's a closer look at why this program is so important.
1 out of every 4 young children is at moderate or high risk for developmental, behavioral, or social delay. In fact, when it comes to the group of developmental disabilities known as autism spectrum disorders, 1 in every 68 children is affected. But research shows that the earlier these delays are identified and children receive services, the better the outcome. Unfortunately, many children experience a lag in identification and treatment. This is particularly true of children in low-income families, such as those served by WIC. These children often miss out on critical services at a time when those interventions would have had the greatest effect on their quality of life. In particular, young children with health concerns, such as low birth weight, slow growth, and high lead levels, may be at increased risk for developmental delays and disabilities. WIC staff may be among the first to observe these possible developmental concerns and refer for further assessment. This program builds on the existing relationship WIC has with this vulnerable population and recognizes that WIC staff are a trusted source of information for families.
The WIC Developmental Milestones Program began as a pilot project shaped by WIC agencies in St. Louis, Missouri. It was further refined by WIC agencies in 4 counties with rural, suburban, and urban populations.
It is based on the Learn the Signs Act Early materials developed by the CDC. It's part of a public information campaign for parents of young children. The campaign's primary messages to parents are: learn the signs of healthy child development, act early if there's a concern, and talk to the doctor.
Those messages are built into a series of age-specific checklists ranging from ages 2 months to 4 years. Each checklist outlines the social and emotional, language and communication, cognitive, and movement skills that most typically developing children demonstrate by a specific age. The language is clear and simple. The layout is bright and inviting.
Parents routinely complete the checklist as part of the certification and mid-certification process. The checklist can also be used anytime a parent or WIC staff member has a concern about a child's development. This can be done while staff is entering data, then completing the checklist adds minimal time to the appointment. If the checklist indicates a possible developmental concern, the child is referred to the doctor for screening, just as children are referred for low iron and other concerns.
The checklists are reinforced by colorful, family-friendly graphics in the WIC clinic. These introduce key concepts of early child development in a fun, interactive way.
Well, the children love the graphics on the floor. They are always drawn to the colors. The parents love it because they're getting tidbits of information, and we catch them all the time looking at the wall graphics and reading it.
All these materials were created based on feedback from WIC staff. That input was even more important when it came to integrating the program into clinic flow.
Building the program into the regular intervals of certification and mid-certification increases the likelihood that developmental delays will be caught earlier.
Here's why. The onset of developmental delay and disability may be apparent shortly after birth, but some children develop typically at first and then decline in their developmental growth trajectories, just as with physical growth. Research shows that when clinical impressions are used to monitor development in physician practices, children with delays are often missed. Simply keeping an eye out for developmental concerns does not work. This makes recurring WIC certification and mid-certification appointments a logical and effective fit for developmental monitoring.
This is one of the reasons the program has had such positive results, as documented through studies with WIC staff and families. Almost 100% of WIC staff said that parents were willing to complete the checklist, and nearly all parents reported that they learned new information about their children's development. WIC staff members indicated the program was easy to implement, with 80% reporting that the program takes 5 minutes or less. In fact, some staff reported that when parents completed the checklist during data entry and no referral was needed, the program added virtually no time to the appointment. Likewise, almost 100% of WIC staff said they referred one or more children. 90% said the program helped them learn when to refer and how to support parents through the referral process. Most importantly, the program helps children get the services they need. We tracked 84 referrals, and 2/3 of those children were seen by their doctors because of the referral. Of those, 41% were referred for additional testing by another professional, and 29% accessed intervention services by the time the study was completed.
Based on this positive response and impact, local WIC agencies now have the opportunity to offer the WIC Developmental Milestones Program to the families they serve, at no cost. Staff simply distribute checklists during certification and mid-certification appointments, or when staff or parents are concerned. Staff then review the checklists with parents and make referrals to the doctors when indicated. Online training, online ordering of materials, and technical assistance are readily available. Participating agencies will receive developmental milestone starter kits, including checklists in floor and wall blocks, in English and Spanish. No other languages are available at this time. The wall blocks and floor blocks are bright and colorful and adhere easily to most hard-finished surfaces. They can be removed without damaging floors or walls. Each nutritionist or other competent professional authority who will be implementing the program will receive a complete set of milestone checklists. The checklists are supported by a downloadable implementation manual, including a talking points document developed by WIC staff. It details the key words and procedures that have proven both sensitive and effective when talking with parents. After materials are in place and a short online training video has been viewed, staff are ready to help parents better understand their children's development, and staff will know with confidence when to refer to the doctor for screening and evaluation.
The program is so simple, it can be adapted to any clinic flow at any time. But here is how it is typically integrated into certification and mid-certification appointments. WIC staff hands the parent an age-specific checklist to complete. This is done while the staff member enters WIC program data. It takes downtime in an appointment and makes it productive. WIC staff quickly scans the checklist, counting any missing check marks and noting any marked warning signs or written parent concerns. When the checklist indicates a child has reached his or her developmental milestones, the parent is encouraged to keep watching for and celebrating the child's development. No further action is needed.
When the checklist indicates a need for referral, WIC staff folds the checklist so that a printed referral message shows and gives the folded checklist to the parent, instructing the parent to contact the doctor for a follow-up appointment. The folded checklist contains the language that the parent can use when talking to the doctor, and the doctor will then have the CDC checklist indicating the area of possible developmental concern. The referral can be noted in the child's electronic file for follow-up, and an alert can be set. The family can use the follow-up as their required goal for that appointment, if appropriate. This enables staff to follow up with parents as they return to the clinic to ensure that the child has been seen by the doctor.
Well, I've seen it impact families a huge deal. I mean, the clients that we have here were really open, first of all, to always fill out the checklist, which was great. And then anytime that we did have anyone have a referral and we followed up with them about it, almost all of them actually, the doctors were proactive about, getting them into different services, which was great because unfortunately we see a lot of clients here that they really are not getting the help that they need. So I feel like this has definitely helped bring kind of it to the doctor's attention.
So pass the word. The WIC Developmental Milestones Program adds real value to WIC's role in safeguarding the health of young children. And there is no cost for materials. Local WIC agencies can enroll online and get started with the WIC Developmental Milestones Program right away.